Our speaker today is Dr. Tara Haskins. Dr. Haskins is the Total Farmer Health Director for AgriSafe, a national agricultural health and safety nonprofit. She holds an MSN in psychiatric family mental health nurse practitioner from the University of Texas at Arlington and a DNP in nursing forensics from the University of Tennessee. Dr. Haskins has 36 years of registered nursing experience, 17 years in healthcare education, and is a board-certified advanced holistic nurse. In addition to overseeing partnerships to support AgriSafe's total farmer health initiatives, she is responsible for AgriSafe's mental health programming, lead for farm response training, and quality assurance of quality agricultural community currently in 10 states. So the quality assurance for the AgriStressed helpline is the only 24/7 suicide crisis resource, and it's in 10 states. Dr. Haskins is a certified instructor and lead for AgriSafe suicide intervention trainings, QPR for agricultural communities, and CALM, Conversations on Access to Lethal Means. Dr. Haskins is a 2018 Rural Health Fellow from the National Rural Health Association and an AgriSafe Nurse Scholar. And with that, I'm going to turn the presentation over to Dr. Haskins.
Oh, thank you so much, Liz. All right, and thank you everyone for joining us today. Wow, we've got a nice, robust group here. This is exciting. I'm going to share my screen. And I'm going to put this in presentation mode. All right, Liz, do I look okay?
You look great. It looks
Okay.
perfect.
Fantastic. Well, thank you so much for joining us today. And I'm hoping to share a little bit about AgriSafe's approach in this space for health education. And we really are going to focus really on the mental health programming, which has become, wow, I mean, just our mental health work has exploded. And you'll see when we get to the end of today's presentation, the variety of trainings that we provide in this space. So just to kind of set the stage here, I am going to talk a little bit about the total farmer health model. That's how AgriSafe, how we sort of group together our content. It's also a great model that we can talk to producers about because it's visual, and it's a nice illustration of all the factors that impact the total health of people that work in agriculture. Then we're going to talk about some behavioral health risk, and I do want to share some mental health resources. We got a lot of great trainings that are available. Many of them are free. And so we want to encourage anybody in today's audience to come. And then I do want to kind of share the AgriStress helpline, which AgriSafe, this is one direct service that we do provide directly to producers and agricultural communities. And I'll share that with you. AgriSafe has been around for over 23 years. We were incorporated in Iowa, but our home office is down in Covington, Louisiana, which if you don't know that area, it's down close to the toe of the boot and close to New Orleans. And it was founded by public health professionals and nurses because they felt like there wasn't enough being done to take care of the health of people that worked in agriculture, and that they felt the inherent risk in this work were so unique to other occupations that somebody need to put that mantle on and go forward. So our tagline is protecting the people who feed the world. We do train rural health professionals, a range of doctors, nurses, OTs, PTs, social workers. But we also have stepped over and have our foot on the other side of the line doing producer-facing trainings as well. And then I'll share a little bit, kind of show you some of our partners that we work with. This is, hey, you guys are seeing, this is the first audience that's seeing the brand new photo for AgriSafe staff. This was taken just several weeks ago down in Covington for our staff retreat. And many of these individuals, some of them, about half of our staff, or maybe less than half, live down in the Covington area, but the remainder of us work virtually. I'm coming to you from North Louisiana and Shreveport, and we also have individuals such as Linda Emanuel, who is our community health director in Nebraska. She's also a co-producer on her 3-generational family farm. We have Stacy Jenkins, who's our learning lab director. We have Laura Siegel, who is our health communications officer. So we do have a national reach. So where do we get our information? As you can see, actually, AgriSafe is a small team. And actually, this team has probably doubled in size over the last couple of years. But we still consider ourselves small, and we don't have the full expertise in all areas. So we seek out experts such as that work through your department or the CDC, NIOSH centers, EPA, public health departments, extension offices, those individuals that are doing research. We try to bring that to our audience. Our virtual audience tends to be more professionals that work in support services for people working in agriculture. It's kind of hard to ask a producer to join us for an hour webinar at a noon hour. But we do also have some programming that is really, they can certainly join us. We have resources for them. We do boots on the ground, farm shows, ag events where we can reach those populations and communities. And we also have a podcast, our Total Farmer Health podcast. And so we source out the best experts to provide us with the content. So if you go to our webinars, you'll see the speaker bios that are there. And many times they may not be somebody that actually is AgriSafe staff. We're really proud of that because we feel like we want to bring good content to our audience. So here are the NIOSH Centers for Ag Safety and Health. This audience may be very familiar, and we have some very close partnerships with quite a few of them, some stronger because we actually maybe have grant funds that we're working. For example, Southwest Ag Center here in the state of Texas. I was just over at University of Tyler the other day at the Rural Health Day doing a presentation. Strong partners that we have at CS Cash in Nebraska. We do grant funding work in mental health. We are CS Cash's mental health go-to for programming. We have board members that come out of the Florida NIOSH Center. We're doing some helpline work now through the center up in the Pacific Northwest with Don McMorrin. So just a variety of centers that we try to collaborate with and work with on a regular basis. And so I want to kind of talk a little bit about the total farmer health model. And if that sounds familiar to you, if you know the total worker health philosophy, then there's a reason for that. AgriSafe is a total worker health affiliate. And probably about 5 years ago, they got permission from CDC's Total Worker Health to develop a total farmer health model. There are aspects in total worker health that they felt like certainly did apply to agriculture, but they wanted to expand that to really make it very specific for total farmer health. And there's a lot of crossovers, like, we have full-time workers in agriculture, part-time workers, we have migrant workforce, which is our mobile workforce. There are certainly distinctions between the young workforce versus the old, male versus female. And we have a lot of farmers out there that may have some physical disabilities. We have a large population of veterans that work in farming. Some states are significant numbers, and those may bring all of the experiences they come with us after being deployed. So the community of agricultural producers and workers is very wide and diverse. And so AgriSafe pulled together, and this is our total farmer health model. As you can see in the middle, we have the farm family. We felt like that was really critical. If you're familiar at all with agriculture, then you'll know that you may be familiar that over 90% of farms in the United States are family-owned farms, whether they are large family farms or small family farms. And a large number of those are our small family farms. And so we have a situation in this industry where the family is heavily involved in the work that they do. So that brings about risk for, children who many times, take up farm work or in their early years, and the dynamics of the family that feed into agriculture, which I'll talk about a little bit more later. But these are the big buckets that we feel like are important with regards to total farmer health. You can see that finances is one of our icons. You ask an ag producer, what things are you worried about the most? And usually finances comes to the very top of the list. the hazard icon here. I'll talk and expand on that a little bit more. We recently, in the last 2.5 years, added the spirituality icon. We know that these individuals live in rural communities, and many times their spiritual supports are one of their main supports. It's also a source of socialization for them, and plays a huge role. And as an advanced holistic nurse, I was so glad for us to do this, because spirituality is a key part of both your physical and your mental well-being. Healthcare access, we'll talk a lot about that. We're talking rural communities here. When we look at healthcare access, there are a lot of challenges. Weather, which many of you on today's call are probably familiar with. I have a few pictures of that. Sleep deprivation, big problem in this population. The social networks that exist and how sometimes the social networks overlap with the work networks as well. And we did include fitness. We know that farming is hard work, but it certainly sometimes does not equate physical fitness. In fact, many times during planting and harvesting season, individuals are sitting in a large piece of equipment for 12 hours a day. And so we know that that sit time creates problems for their health, for their back, for musculoskeletal issues, as well as sitting in the seat for many, many hours a day. So I'm going to lead into and kind of talk a little bit more and elaborate on a few of these icons. I can take questions on the other icons before we dig really deep into behavioral health. So when we look at injuries in agriculture, of the 3.4 million farmers working in the United States, and those are producers, okay, and those are typically primary producers with some secondary operators. Certainly, I'm sure we're missing some of those numbers, but that's the general number that we use from the 2017 USDA census. The work that is done in agriculture ranks as some of the most hazardous. And this statistic, every day, about 100 agricultural workers suffer lost work time injury. If you think about it, that's why safety is such a huge portion. And these NIOSH centers contribute such an important role for the ag communities. Remember, I said many of these farms are small family farms. So we have producers that are, you know, some of the main workforce. They also may be employers to other individuals on their farm. These individuals may be family members, they may be farm workers, they may be migrant workers. And just the fact that they're working with large pieces of equipment, large animals, things such as anhydrous ammonia, you know, from like swine barns, respiratory issues, tractor rollovers are a huge issue and a cause of death in this population. And so safety is really, really critical. So we really try to talk a lot about that with our producers. And this is the hazard icon. And there are many, there's respiratory hazards. There are, you know, physical hazards, like I said, with machinery or livestock. Motor vehicle accidents are a huge issue because these individuals are driving large pieces of equipment very slowly. And usually what happens is there's some kind of encounter with an individual, a regular home pedestrian, you know, driving another vehicle, having an accident with a large piece of farm equipment. And then the nature of the individual, these producers that are driving these pieces of equipment around on their property, many times there is unfortunately poor visibility, and we see farm accidents happen with the pieces of equipment all the time. Confined spaces, grain bin entrapments, that's a significant issue. Every year we see a story come through about somebody that was entrapped in a grain bin. And there are recommendations for not getting in those grain bins, and there's a lot of high-tech equipment that is helping farmers to not have to, you know, go into those bins. But of course, you know, sometimes the way work is done for many generations, and farming is a multi-generational occupation, sometimes people tend to do the work the way they were taught to do it, you know, many, many years ago. So Exposures to pesticides and chemicals, that's a given. We do know that there is increased risk, and there is an increased risk of mental health issues associated with pesticides exposure. So AgriSafe, what we do is we really emphasize proper protective equipment when using these as specified by the manufacturer. So these risks are wide and range. It puts them at risk for chronic illnesses, skin cancers, cardiovascular disease, exposures to chemicals, induced hearing loss is a big issue, which also contributes to, unfortunately, decreased mental health because of the lack of connectivity to people around you. When you have a hearing loss, you can't participate in conversations. It also is a safety issue because you can't hear the environment. So they're wide ranging. As I said, sleep plays a critical role. People that work in agriculture, especially during sometimes harvest, particularly harvest, and now because we have capabilities, they have GPS, they have lighting on equipment, they can work till well deep in the middle of the night, especially if a producer is looking at trying to stay ahead of the weather in order to get a crop in or get a crop out. These individuals are going to be sleep deprived. And in terms of livestock, especially during calving season, you may be up all hours of the night, helping your livestock whenever they're delivering their calves. Sleep deprivation contributes to increased injury rates. Increased injury rates contributes to long-term chronic pain issues. And of course, then that spirals into, unfortunately, significant opioid use for some individuals. And all of these negatively impact total health, but we see deep connections with mental health as well. And that lack of sleep, it makes it really hard for a producer to make good decisions the next day. And these individuals are making financial decisions on a daily basis. They are watching those markets on a daily basis. Moving on to money. As I said, this is oftentimes the first thing that they will list of whether they worry about the most. A producer, not only is their business many times extended out financially, but you're also looking at supporting your family. Many times extended family, you have multi-generational family farms that depend on the farm for their livelihoods. This can impact their ability for a sound retirement, expenses. And we try to approach mental health in this population as an important component of financial health, because we try to emphasize that an individual is the most valuable asset they have to their production. And if you don't have mental health supports or strong mental health or mental health resources, that can be a detriment to you financially. Healthcare access. So we're talking about rural communities here. I'm sure you hear in the news, I belong to NRHA, and every year it's about how many rural hospitals have closed. When rural hospitals close, it takes away our healthcare professionals out of those areas because they need to be able to make a living. They have to drive further distances. That means that people live in those communities get limited access to maternal child benefits. They have to drive longer distances in order to see providers or specialists. Some of the statistics that I could share with you, about 20% of Americans that are in rural areas are only served by about 10% of our physicians in the United States healthcare system. And then when you narrow that down to mental health professionals, it's even worse. I mean, most every rural area in the United States is lacking the needed number of mental health professionals that they have. And then we have to deal with the stigma that's associated with that. I'll talk about that later. So healthcare access, getting to healthcare, that accessibility, but what about affordability? So when we look at some of the data, most producers, when I'm talking producers, many times those individuals making those financial and daily decisions on the farms, many of them have healthcare insurance, but especially the smaller family farms, when they are doing the lion's share of the work, they may be underinsured. So they may have insurance with high deductibles. And that can be a significant, and that can play a role in their decisions as to whether they're going to seek healthcare or not. And then we move into the weather icon. So here's our weather button. I sometimes feel like that should be a much bigger circle than we show it on here. So just so to emphasize, the size of the icon there does not relate to the importance or the significance. They're all, we see them equally significant. This is just a demonstration of the different types of climate hazards that they predict are going to be happening in 2050. And climate is a big thing that most producers are now talking about it. They recognize the impact. This is the effects of the derecho in Iowa. And you can see this corn was tasseling. Look at all the ears that are on the stalks. And this guy is looking at, wow, I mean, so close to getting that crop out of the field. And not only the devastation to the crops, but there's devastation to buildings. There were the pictures following this Iowa derecho were just heartbreaking. Some other photos I could share that I pulled from our flood webinar that we did with specialists. We actually had a veterinary specialist on large animal evacuation, as well as providers talking about the mental health effects of flooding. Here's a farm. There are a lot of risks that happen on farm, not only the threats to the physical well-being of the workers, the farm family, and the livestock, but then we also have issues of pesticides getting into well water and contamination of water, you know, with animal fecal matter. And then the other thing is, I'm sure you could imagine, many times producers feel an obligation to care for the livestock that they're raising, and they will not leave their sites if they're not sure that their livestock is taken care of. So unfortunately, that can result in increased risk for the farmer or for the workers that are there trying to evacuate large animals. And then of course, you know, evacuation of large animals is a very, very dangerous time because those animals are scared and an individual could sustain significant injuries. Some more photos of farms and the impacts of that, being able to get vehicles out. There you've got cows in the water. So far and wide reaching, certainly, with flooding. And so these are some of the issues that we know exist when a flood happens. There's also the trauma that exists when a disaster happens, and getting access to healthcare providers is another issue. So we have a lot of resources that talk about some of these issues. The one I really do want to share with you is we have these, and these are printable from our website, and we have both a spring and a winter because there are different risks for different seasons, but these are a nice document for producers, kind of gives them some things to think about, some things they might need to consider. It does talk about, you know, mold growth, and then, and this is a nice, you know, picture of that. But then on the back, there's a lot more information about some recommendations, prevention types. And then it links to some really good other fact sheets that can go into greater detail on zoonotic disease, respiratory selection, talking about mental health. You know, good tools to use. They are free and printable from our website. So we want individuals to use these. And then this was a webinar that we did on winter farm health threats during recovery. It's been a while back, 2019. We've done another one on farm flooding. Like I said, we had veterinarian Dr. Rebecca McConico from Louisiana State University, who heads up the animal evacuation disaster teams here in the South. She came in and talked about some of the issues, as well as we had a physician that focuses on the mental health. And then I did a little piece on that, talking about managing your farm workers and things to look for individuals that can be impacted by trauma. Wildfires, another good example of those disasters. You know, it's one thing to tell people when there's wildfire season, don't go outside. But when you're a producer, it's really difficult for you not to be able to, because that is where your work is. And so these standard advice of avoid going outside, stay indoors, keep activity, it really just does not work for agriculture. So AgriSafe tries to really focus on safety and respiratory protection. And we have a great rainbow guide for respiratory protection that gives a producer an idea of what do I need to use for a certain situation? You know, is this a chemical exposure? Is this like smoke exposure? So we try to make that easy for things that they can tack up on the inside, maybe of their work barn, where all the workers come through and the producer to kind of help remind them. So we also have similar resources that are available for wildfire threats. So you can see some of the things they need to consider. And on the back, it mirrors the flood resource that we have. I'm very proud that, you know, we emphasize mental well-being on everything we do. We feel like this is a holistic approach. It should be integrated. There's a lot of things that when you're focusing on a disaster, that these things may get overlooked or pushed to the side. We want to kind of keep those preventative tips up, you know, try to get sleep, ask about resources, and look for signs of stress, anxiety, inability to make decisions, not only for yourself, but maybe for the workforce that you're responsible for. And then, of course, in terms of disasters or emerging issues, AgriSafe, we try to stay on top of what's happening. Because we're a national nonprofit, we can pivot really quickly. So, for example, when COVID came to the forefront several years ago, AgriSafe hosted weekly webinars for people in agriculture to try to help keep them on what is the newest information that's coming out of CDC. As we remember, you know, that was a learning process for everybody. And producers really needed guidance. I mean, they still had farm workers. They transport farm workers, you know, many of them sometimes in a large van. They share equipment. And so, you know, producers are not public health professionals. They didn't know really how to keep themselves, their family, and their workforce safe. And so AgriSafe every week tried to do updates where the mandates were, what the recommendations were, where you could get PPE, how you could get COVID-19 vaccines. And so we stayed on top of that. But we do that for other things. The mental health crisis, I'm going to share that work with you. We've done some work on avian influenza, and we're watching the African swine fever as well. Some of our partners, Missouri State Department of Ag, you know, we know that these departments of ag are doing sort of these mock crisis events if, you know, African swine fever ever enters into their states. So we try to stay on top of what's the issue that producers are facing. And many times these issues create an additional layer of stress that they're not prepared for. Okay, so kind of want to talk now about our mental health programming. AgriSafe has been in the space of mental health of producers well before I came on board. I've been at AgriSafe 3 years. I was brought in to be their behavioral health lead because they saw on the horizon, like I said, they're always looking, you know, trying to stay ahead of that curve of what's going to be needed. And I will say over the last 3 years, AgriSafe has built up our behavioral health programming significantly. And I want to share some of those with you. But before we share the resources and perhaps opportunities to learn with us, let's just talk about this issue with behavioral health in agriculture. So it is, as in most individuals that experience crisis, it is not usually a single event that has created a situation where an individual has completely expended all of their coping mechanisms. Many times there can be an event that just pushes them over the edge. And so the reason I like this slide is because it shows you all the different things that contribute to the stress levels and that can impact coping mechanisms for an individual that are present at all times. So it's easy to see how an individual that might be impacted by a disaster, you know, can totally fall apart, not only from the trauma of the disaster, but they may have been dealing with issues of family relationships. This may be a young producer that is struggling to get things, off the ground. And so some of the hazards play a role in mental and physical well-being. Those are listed to your left. Technology, sometimes that can be a blessing and a curse. Farmers today use a lot of technology, and when they don't have access to accessibility and technology, that can sometimes cripple them. That can I know it creates stress with me, and I'm just trying to be on a computer, but for those individuals that are, looking at large pieces of equipment, GPS, that can create a lot of stress. All of the uncontrollable factors that we sort of talked about. Markets, as I said, these producers, I asked a producer in Nebraska, I was like, how often do you check that? And he goes, oh, every morning after my coffee, I listen to the markets. And I was like, wow. I mean, depending on if they're doing well, that can be a certain boost for the day. But if markets are not doing well, they're having to make decisions. And I can only see how that could weigh on a person's thought process and hope and outlook for the day. And then, of course, the pandemic, COVID-19 created a huge amount of stress. And then we have those stressors that pop up with these zoonotic diseases that we see. But in terms of the daily workflow, and those things that impact these families, we know that there are certain illnesses that impact producers. When a producer is ill, they can't be engaged fully in the production. And so when they have to go away from an injury, maybe or hospitalization for a heart issue or a lung issue, that really bootstraps the production. Heirs property, particularly in the South, but certainly all over the United States, legacy issues with farm productions is a significant stressor. Because over 90% of farms in the United States are family-owned farms, many of them have been in families for over hundreds of years. And so the stress and thought of losing that farm and not being able to pass it on to the next generation, which is many times when you ask a producer, what keeps you in this? Many times they say, I love the work and I look forward to passing this on to my sons and my daughters for other generations, because that gift had been given to them. But unfortunately, for some heirs, particularly producers of color, heirs property issues can create stress, because if they have not taken care of those legacy issues legally, sometimes we see some farms that may have ownership of over 50 individuals, which makes it very difficult for those producers that are trying to work that land to make a significant profit, as well as make decisions if there are more individuals. So that is a specific issue in agriculture that we see. The blurring of the lines of those family relationships. You work with the people that you live with on a daily basis. That can be great because it creates some significant bonds. But as you can imagine, if you've ever tried to work with families, sometimes that can be kind of challenging, especially if maybe a family member is struggling, say, with substance use, and you're working alongside them. Maybe you're equal partners in that production, and you've got to be the person to, call time out and significantly push them to get some help. Finances, we talked about that. And just a couple more things about these different individuals that are in production. Aging producers. Over the majority of producers today, the average age is 58, and a large group of those are in their 60s. And so agriculture is one of those industries where we see people in their 70s and 80s still working in this industry. And so an aging producer many times brings around more issues with physical illnesses, safety issues for them as well. And then when they're multi-generational, we see the care of those aging producers by the other family farm members. And many times that role is taken on by your female partners in these families, which may also be serving as being a primary or a secondary producer. Female producers many times have the responsibility of the children, some of the large line share. They may be the one managing the financial books, Many females may find themselves having to take an off-farm job in order to get health insurance to cover the family. But we also see producers doing this. So they may not only have the production they're responsible for on a daily basis, they are also working an off-farm job, which you can only imagine how that can impact your workload. And then our young and beginning producers, we do see they have struggles. They don't many times have the capital to be able to build up their production. They sometimes have difficulty with getting loans, getting land, just purchasing land. It's hard to come by because many times that's passed through individuals. People sometimes get first choice. So they bring a lot to that are significant. And I'll share some research from Mercer University that was pretty significant about young and beginning producers as far as mental well-being. And then of course, stigma. So we're in rural communities. If you happen to have a mental health professional working in your town, to have your pickup sitting outside that office, you don't want people to know your business. Many times you may sit in a pew right next to, people that work in your community. You may serve on PTA boards, school boards. Many times producers are leaders in these communities. And so the stigma of mental illness or needing to seek help for mental stress is enough to keep them from that. It's getting better, and I'll share some data for that. So this is that agrarian culture that we see. This is a 3-generational family in Nebraska. They are row crop farmers. We have the dad here who grew up in agriculture, mom grew up in agriculture, and these are the 3 sons coming back. And so agriculture is a way of life. Many of them live on the land outside their window. They are seeing the work every day. They work together, shoulder to shoulder, side by side, and they see this as legacy. Many of these families, their identity is deeply embedded in this way of life. You see wedding photos taken on the farm. You see family get-togethers in the barns. You see high school photos being taken in cornfields. And that's because it's a big part of who they are. And so when we see producers that are at a place where they might be losing that ability to continue that identity, that's where we see a lot of the mental stress and unfortunately suicidal thinking as well. So in looking at some of the facts we know about, American Farm Bureau has done 2 wonderful surveys. They're fantastic partners of AgriSafe. We love working with them. But back in 2019, they did a poll. And some of the things that came out of that, they had agricultural communities in that as well as rural communities. Over 90% said that mental health is important. Okay, so I think when I saw that, that's encouraging because we know that people recognize the importance of mental well-being. But they also recognized that stigma was a huge problem. And they said that media, community, and unfortunately friends, that's how they see the stigma sort of perpetuated. They followed up with that survey in 2021 with another national poll. And this was after, work in 2018, 19, 20, and some of 21, working to chip away at this stigma and having conversations in these communities about mental well-being. And they said that stigma around seeking mental health was less, but it still remained a major factor. And that we were glad to see that farmers and farm workers said they were more comfortable talking to friends and family about mental health than they were back in the 2019 survey, but they were experiencing more stress than a year ago. Now, think about the year. This was 21 after coming on the heels of COVID-19. COVID-19 devastated many of our producers. We had dairy farmers pouring milk out on the ground. We had individual producers, swine producers couldn't get their production, to processing plants. Processing plants were getting shut down. So there was a whole level of stress that had never been seen in this industry then. And it doesn't, it takes longer than a year to get over that. And some are still saying financially, they're still being impacted by, unfortunately, that period of time. And then if you look at the CDC data, this is only as current as 2016. when you look at suicide rates, the occupational group that includes agriculture, forestry, fishing, and hunting ranks as fourth highest. And then if you pull out agricultural managers, those people making daily decisions, their rate is even I believe it's about 42.3 per 100,000. So that subgroup in the occupational group ranks even higher. And oh yes, I have it right down there. And the other thing to remember when it comes to suicide is that we generally see over 50% of suicides in the United States, death by suicide is with a firearm, but 80% of agricultural suicides, higher percentage involve a firearm. A lot of this comes down to access. Firearms are tools on these farms. They're used to protect livestock. They may have to put a suffering animal down. Many of these individuals have identities also with hunting. It's part of their growing up. It's also a socialization activity. And so the access to firearms is certainly greater. And we do know that in rural communities that exists as well. One other research I wanted to share with you that came out in 2022 through Mercer University. They surveyed over 500, it was producers, farm workers. I may look here at my notes to make sure I get these stats right for you. Farm workers, farm managers, and spouses, which, as I said, many times function as secondary co-producers. And they surveyed them about mental well-being. And so just a few of the highlights. Most of them said that they love the work that they're doing. So even the stress that they're impacted by doesn't take away the joy that they feel and the motivation and the pride that they feel in this work. I mean, they are contributing, to our country in a significant way. But their stress comes from a variety of sources, they indicated. At least 1/3 in this survey indicated that they had had suicidal thoughts at least once in the past year. Less than 1/4 in this survey said they had access to psychologists, mental health professionals. 12% of them said they wanted to seek mental health services, but had just not done it yet. Now, there's a lot of factors. Stigma is one, but some of it's the distance. Some of it's taking away time from a production. It's hard to justify if you're going to go see a mental health provider and you have to drive an hour away to see them, to justify that time. We try to talk about how important it is, but it's hard when a producer is looking at taking 4 hours away from their day from the farm to go see a mental health provider. We see telehealth as a great option and very important. And then more disturbing that came out of this Mercer study, 60% of first generation farmers had thought about dying by suicide. So the load of this stress seems to be even greater on our first generational farmers. And unfortunately, 10% of those said they had thought about it daily. So we still have issues. We still need to work towards solutions. And then when you couple that with the opioid crisis, just to touch on this, because chronic pain is pretty common in this population, injuries, major injuries can be unfortunately common. 74% of farmers and farm workers said they've been directly impacted by opioids. 3 in 4 said it's easy to access it. But again, rural healthcare deficits that we know exist, only 1 in 3 rural adults said it would be easy to access addiction treatment. And access to treatment, the accessibility of treatment is a major barrier for this population. Over half of the counties in the United States have no mental health professionals. And those that do, many times don't have enough for what they need to serve. That's why it's even hard to get in. You'll go to call and get an appointment. It may be 3 months before they have an availability. And if you're experiencing significant stress or crisis, it's really hard to find someone that can take you on. And then for, primary care physicians working in rural communities, behavioral health can sometimes encompass about, almost a quarter of their workload. And primary care physicians are, there are workhorses. but they're not great places for ongoing counseling. They can certainly help us bridge the gap, but their role is not necessarily in counseling. But we do rely on them to use them as sort of a gatekeeper to help individuals that come to see them. Because an individual in a rural community might be more comfortable speaking to the primary care provider than picking up the phone and calling a mental health professional in their town or maybe one town over. And then the other thing that AgriSafe is trying to impact is that we know that health professionals receive very little training on agricultural occupational health and may not understand the culture of this population. So I'll kind of now want to kind of move into some of the things that we've done that I want to encourage you. Elizabeth and I were talking before this got started, and we shared a commonality in that she had just worked with Dr. Strand. We invited her to come in and do an animal depopulation webinar for us, and we worked alongside CS Cash to link her resiliency check-in tool, which is a tool that can be used by producers for checking in for mental stress when there is a depopulation event occurring or an HPI event. And it's also a tool that they can use to check in with their employees, the farm workers that they employ. So we were really excited to partner with Dr. Strand. And this is an example of that tool. This was done in collaboration with CS Cash, see here at the bottom. And this is sort of a two-sided. It talks about foreign animal disease, the impacts, knowing the stress and depression signs. Again, here is that QR code that goes directly to that tool that a producer can use. It also shares many of the resources that could be available for an individual that may be experiencing stress. Some tips, some things to think about: getting plenty of sleep, don't forego meals, avoid caffeine, alcohol, and ways to sort of relax. And then AgriSafe provides a QPR training, which is a suicide gatekeeper training for farm families. It's really specific for farm families. That may be a training that could be beneficial for individuals on these farms. And so I want to move sort of into our mental health programming. I love the range that we provide. We provide trainings for communities like QPR. We provide youth mental health, or cultivating a healthy mind training. We provide trainings for healthcare professionals, which is what Farm Response is. We provide specific trainings in suicide. We just started delivering CALM, which is Conversations on Access to Lethal Means. It is a part of suicide safety planning, talking about access. This is a conversation that many, even healthcare professionals, have a hard time navigating, but certainly would be difficult for a family member or somebody in the community to navigate with someone that they're worried about at risk and wanting to make sure they're safe about securing medications and firearms. And then, of course, the AgriStress helpline. And I'll talk a little bit more about that. So I'm going to show you Farm Response and our QPR trainings later. So we're really proud. We launched the AgriStress helpline in 2022. We started out with 4 states. We are now up to 10 states, all listed here. This is a suicide level crisis line. So if an individual calls this line, the line has been answered by crisis specialists who are trained and credentialed through American Association of Suicidology. They are part of the 988 system, but the unique piece that they have received training from AgriSafe on the factors that are impacting agriculture. So when someone calls from an agricultural community, they don't have to start from ground zero, explaining why they can't just take time off. These specialists understand the barriers that exist. They understand the values of this community. They understand the factors. They also have access to a well-curated resource database that has both behavioral health resources for that state, as well as agricultural specific resources, state lines, hay lines, where to find farm workers, where mediation services, you name it, we have that on there. The line is available 24/7. It's call and text. The number is the same for all of the states. And it can be answered in 160 languages through telephony translation services. And the text line can be communicated in English, Spanish, and in Vietnamese. And we are expanding this line to also include other forms of agriculture, such as forestry and logging and commercial fishing as well. So really proud that these partners, these states have come on with us, and we're just trying to make a difference. This line is about saving lives first, making sure, doing suicide assessment. If we need to deploy emergency services, we have all of the 911s for those states that we can do that safely and securely to an individual and provide them the resources that they need. Here's the other issue that we really wanted to make the marketing materials speak to this population. So you're going to see that it's going to look like producers. Some examples, producers in different states may look different. So some of them may wear ball caps, or maybe like in Texas, like here, they wear the big cap with the big brims, wearing short sleeve versus long sleeve shirts. I mean, we really pulled in individuals in the communities to say, do these pictures speak to you for ag, for your state, whether it's Wyoming versus Texas versus Pennsylvania versus Virginia. Then, of course, some of our images, look at this. I mean, doesn't this look like a producer's hand? And we hope that this really can speak to those individuals. We try to include a gender diversity as well as diversity in languages. Our commercial fishing, and we're also expanding into Vietnamese translations for some of the marketing materials. That's a particularly high population in commercial fishing. And we're working very closely with Oregon State University and Oregon Department of Ag to make sure that this line is acceptable and accessible for farm workers, to make sure we don't have any barriers there that would prevent an individual, a migrant or immigrant worker, to feel like that this line could be for them as well. And so I do want to kind of share with you our website, and then I'm going to take questions. This is our website. Let me know, Liz, if you can't see it. But if you come to us with our current projects, you can scroll down and you can see information on the helpline. If you want to get more information about the helpline, all of that is here. It's got questions. We have marketing materials. We've got informational videos about that. Going back, we have an AgriStress Response Network that does a monthly innovation mental health exchange. It's free. You join us at your computer. You can hear about the great projects, little flash talks that people are doing in their states that many of those ideas have been applied to other states, such as challenge coins or, a peer support community. We have the farm response training, which is for our healthcare professionals. AgriSafe has trained close to 1,000 healthcare professionals across 41 states. And we have free seats in a lot of these states. You can submit an inquiry form. If you're interested in taking farm response, you can take it. There is a charge if it doesn't have a funded seat, and we try to get as many funded seats as we can in different training in farm response. We are now expanding those individuals that have completed farm response to joining our farm response directory. There it comes. And so individuals, healthcare providers, behavioral health providers trained in farm response, they are listed here. This is public facing ag communities, and our crisis line uses this to search for providers in their area. And we're going to expand this to include health literacy information as well. We also have our QPR training, and we have a monthly free one. You can join us. We have one coming up soon, December the 7th. If it's been filled, you can join the 17th. This is about an hour and a half training, front loaded with the aspects of agriculture and why it creates such mental stress. And then the QPR method, how you talk to an individual in crisis or that you're concerned about suicide. So it gives you the tools and the confidence of being able to have those kind of conversations. We don't stop there. I'm just talking about the mental health. We have lots of webinars. We have a nurse scholar program. We have other professional development, and we have our great podcast. And so many times we'll host a speaker for our webinar and we'll ask them to contribute to the podcast. So if you want a little taste of some of our topics, you might go in here and listen to those, and you can find that on Spotify. And so I would like to stop there and take questions.
Thank you so much. What a wonderful presentation. And looking at it and listening to you, I realize there's so many resources out there. So hopefully this webinar also helps our agriculture community to realize that we do have some resources. We do have a couple things in the chat that I'll read to you. One of them is, from what I read, it is estimated that 1.2% of farm families are run by same-sex or non-binary couples. A recent survey of the National Young Farmers Coalition showed that 24% claim their sexuality is being other than heterosexual. Access to appropriate supportive health care providers and social acceptance are issues that affect these families. In addition, I just got an email that's covering up my text. I'm sorry. Social acceptance are issues that affect these families in addition to what all farm families face. I think it's important to recognize and learn about this category of farmers to offer the best service.
Yes, thank you so much. This Maine, Carol Delaney. We recently had a webinar that hosted an individual in the LGBT community that talked about the lived experience, the issues they faced, the discrimination, the lack of community, which is sometimes can be more profound for other LGBTQ communities in our rural areas. Not all, but some. We have great examples of individuals that are navigating that, but not all rural communities are the same. So I would invite you maybe to join that. It was really interesting to hear this person's own experience. We do have partners out of Illinois. Courtney, I'm gonna butcher her name. We tried to host her on a mental health innovation exchange. She did some research into LGBTQ communities to find out what were the factors there. We also know that healthcare, particularly for our trans communities, can be significantly impacted. Less services, again, for those individuals that need those services. So thank you for sharing that.
The other question is, go ahead. Yes, absolutely. Can other states call the number that you put up?
Right. So the states that you see listed have put the funds up to host the line for their state. This is a crisis line. And so we can't have someone call it and say, sorry, you can't call, you're in crisis, you can't call this line. We have to take that call, and we have to provide emotional support and crisis intervention. What a state that's not in the network doesn't get is they don't have that heavily curated database of resources. We do that as part of the front loading of bringing on a state. But we do take call. We get calls from California. We've gotten calls from somebody in another state that's concerned about a family member in a funded state. I saw there was also a question bringing the state on to the network.
Yes.
We're actually in conversation. We have states reach out to us all the time. What would it take? The cost is based on per producer. It's pretty affordable. I will tell you that right now, AgriSafe is heavily involved in trying to make this a national line. We feel like this model could serve the nation, and we would prefer to do this to take away these state lines, serve all producers everywhere, and as I see it, it will give us a better picture of the mental health crisis that we see in our communities by understanding the nature of those calls.
That's great. A lot of good comments. Simply outstanding information, wonderful presentation. Really happy to see a farm specific QPR training. Ditto, ditto, ditto.
Yeah, and that QPR training has some great videos in there of an actual farmer. We also are stepping off into access to lethal means. And so we've done a couple of those, and that we try to do it as farm centric as we can in the case study. So if you see that opportunity, join us. That topic is really interesting. And we're also about to step off into naloxone training. So I'm now a certified trainer for Overdose Lifeline, and we're going to start doing naloxone trainings for this community, which has needed to happen for a long time.
Great. So from Dr. Dennison, the Behavioral Health NTEP Work Group wants to thank you. Wishes to thank AgriSafe and Tara for such a valuable presentation. We have another question. Who would we contact to start the conversation with our states about bringing in the hotline to that state?
So I'm putting both my email and our CEO, Natalie Roy, who is actually the founder of AgriSafe. And you can email both of us or one of us, and we'll start the conversation.
Perfect.
And I see, is there an anti-stigma portion?
Yeah.
Absolutely. Words matter, language matters. And here's going to be our position. Anybody that has a prescription, whether they have a prescription or not for opioids, we need to be talking about naloxone. It is a safety issue, and we need to keep our family members safe that are having to use opioids for chronic pain, as well as individuals that are struggling with that substance. So you can't get into recovery if you're not alive, and that's the position we want to take. It's an opportunity for everybody to get help, whether that's with chronic pain issues or if someone has a dependence that has gone off the rails and is, creating havoc in their lives. We want everybody to come back to the fold of agriculture.